Hi, I'm Dr. Michael Gartner, double board certified plastic surgeon, and we're going to go over the 5 most deadliest cancers which cause death.
Cancer is the second leading cause of death, killing more than 9.6 million people worldwide last year.
So, cancer are a group of cells that just keep on growing and don't stop. Normal cell growth kind of stops when you have other cells next to it, and there are other reasons why they stop, and then they kind of die, and then new stem cells take over and regrow. But cancer cells just keep on growing, and they never stop, so things get bigger and bigger. And there are various different types of cancer. They can be from any cell in the body.
Of course, the term cancer is a little vague, as there are many different types of cancer. Let's take a look at some of the most deadly cancers we can experience. Of all the cancer types, lung cancer kills more people across the globe than any other type of cancer. In 2018, 2 million new cases of lung cancer were diagnosed, and of these, 1.8 million people died.
Wow, just think about that. 2 million people diagnosed and 1.8 million people died.
Lung cancer is so lethal because most people do not even realize that they have lung cancer until it's already advanced to a more deadly stage.
There's a low-dose CAT scan, and there's some biomarkers in the blood which you can get. That would only be recommended of doing that for high-risk individuals.
Of course, smoking accounts for 80% of all lung cancer cases, and your risk goes up the more you smoke and the longer you maintain your habit.
Now, marijuana and vaping has similar carcinogens as smoking, so it's felt that that has the higher risk as well. But it hasn't been very studied. There's no long-term studies. So vaping hasn't been around enough to determine long-term what it is. But they have similar carcinogens, so it's felt that they are just as bad as smoking.
But this doesn't mean you're safe just because you've never smoked. Breathing in toxic substances of any kind raises your risk too.
So high-risk individuals are smoking, age over 50 plus, secondhand smokers, occupation or environmental exposure, such as exposed to radon, asbestos, or arsenic, and family history. Also, if you have any symptoms of long respiratory cough that's not going away, spitting up blood, or any of those things related to your respiratory breathing problem, you should probably get checked.
Another notoriously deadly form of cancer is pancreatic cancer. Approximately 44,000 people are diagnosed with pancreatic cancer every year, and of these, at least 38,000 die. The pancreas is located deep in the back of the abdomen, which makes detecting pancreatic cancer a big problem.
Yeah, usually if you have back pain or anything, because there's not much there, once it starts growing into things, you're going to have pain or symptoms. But yeah, usually it's pretty big by then.
Too often, by the time the tumor is detected, the cancer has already spread beyond the initial site, making it more difficult to treat. Also, the symptoms of pancreatic cancer, such as abdominal or back pain, weight loss, lack of appetite, and even blood clots, are pretty nonspecific, as they can be related to several common issues. Usually, the cancer has spread to your liver before you develop a telltale sign that something's not right, and that pancreatic cancer is the culprit.
So high risk for pancreatic cancer is family history, genetic syndromes, such as BRCA1, BRCA2 genes, which are usually a little more specific for breast cancer. When you have those genes, you can have other cancers as well, such as pancreatic cancer. Peutz-Jeghers syndrome, when you get a lot of polyps in your colon, has a higher risk of having pancreatic cancer as well. Also, late onset diabetes, like over the age of 50. The pancreas also produces insulin, which has to do with glucose regulation, and diabetics who lose that have a higher risk. Early detection is not that great, so usually it's MRI, CT scan. There are some biomarkers that are being investigated, circulating tumor cells or circulating tumor DNA, but those are under investigation right now.
Brain cancer may not be on your radar the way other types of cancer are, but you should know that it is one of the deadliest forms of cancer.
Brain cancer, unfortunately, occurs many times, mostly sporadically, with no identifiable cause or reason.
This type of cancer occurs when there's an abnormal growth of cells in the brain. While this cancer can develop in the brain itself, it can also start in other organs, then travel to the brain via the bloodstream.
Right, so that's called metastasis.
The 5-year relative survival rate following a diagnosis of a malignant brain tumor is only 34.9%. Unfortunately,
So you only have a 39% chance of living 5 years. It's not too good.
the symptoms of a brain tumor, such as headaches, muscle weakness, and clumsiness, are so nonspecific, most people often do not know they have a serious disease.
Right, so high risk for brain cancer is age, young children and infants, previous radiation, some genetic syndromes, family history, weakened immune system. But basically, if you have any symptoms, dizziness, lightheadedness that are kind of happening quite frequently, you should really get checked out.
Another leading cause of cancer death in both men and women is colorectal cancer. An estimated 51,000 deaths will be attributed to colorectal cancer just this year. Almost all colorectal cancers start out as a benign colon polyp, which is a clump of cells that forms on the lining of your colon or rectum. Only 1 in 10 polyps will ever become a cancer, and it usually takes about 10 to 15 years for the cancer to form.
So because it takes about every 10 or 15 years for the cancer to form, that's why colonoscopies on a regular basis, you have no history or otherwise healthy, should be done every 10 years. How can you avoid it? Well, lifestyle helps. Obesity has been linked to colon cancer, decreased physical activity, so you should get regular exercise, eating processed foods and meats, smoking, alcohol, and screening usually starts for the average person with no history at age 45. And the best way is obviously colonoscopy, which should be done every 10 years. Now, they do have some fecal tests or cancer DNA in the stool, which you could do as well. And then there's also CT scans and biomarkers as well, but those aren't as good as colonoscopy.
Colonoscopies are the most powerful way to find and remove a polyp in order to avoid developing this deadly cancer. Of course, one of the most well-known types of cancer is breast cancer. While this particular type is the second leading cause of cancer death for women, men are also at risk.
So male breast cancer is even less detected because most men don't check themselves. Sometimes what they do have is something benign called gynecomastia, which is female breast tissue growth, which a lot of guys have, and a lot of guys don't take care of that and live with that. It's the risk of having gynecomastia be a cancer is roughly about 1%. It's less detected, less looked after. So by the time a male has breast cancer, usually it's more lethal than female breast cancer, only because there's no great early detection and men aren't checking themselves. And if they do, they think it's gynecomastia and then they don't do anything about it.
An estimated 42,260 people will die of breast cancer just this year. Your family history plays a big role here. If a family member has had ovarian or breast cancer, your risk increases. If the relative diagnosed developed breast cancer before the age of 50, your chances are even greater.
So other risk factors besides age and family history are genetic mutations, BRCA1, BRCA2 genes. We already mentioned also if you have those genes, you're more susceptible to getting other cancers like pancreatic cancer. And also lifestyle issue have a higher risk. Obesity, decreased physical activity again, alcohol, and smoking as well. And then there's reproductive risks. As a young girl, if you get early menstruations, you're at risk. As a woman, if your periods last longer and you go into menopause at a later age, you're at increased risk as well. And not having children or having children after 30 years old can also be an increased risk.
Some cancers are harder to detect than others. Regardless, it's important to have discussions about tests with your doctor in order to minimize your chances of being caught off guard by one of these deadly diseases.
So that's why it's important to go see your doctor and get regular checkups once a year. So if you like these videos, hit the subscribe and like button, and there'll be more on the way.